So implant restorative dentistry is really kind of a soup to nuts course on the restorative aspect of dealing with implants. We don't do a lot of surgical placement. We talk about surgical guides. We talk about planning for an optimal implant position, but we don't do any of the surgical stuff. What we do is a ton of the restorative stuff. So participants are going to be creating customized emergence profiles multiple times. They're going to build implant provisionals a bunch of different ways. They're going to be working on implants that are in great position, super set up for ideal conditions. And they're going to be working on implants in conditions that we've kind of created some challenges for them. So implants that are out of position, implants that are at bad angles and all those kinds of things. So how do you adapt? How do you deal with those kinds of situations?
So in implant restorative dentistry, the things that you learn in the workshop, we go through about 18 different exercises. So they're core principles in restorative sequencing in order to have predictable final outcomes. So it can hugely positively impact your restorative practice, because if you learn, I'll say, the subtle nuances in basic things that can help develop the tissue and aesthetic outcome, again, it's transformational, because otherwise dental laboratories are arbitrarily doing in the lab without really guidance from the clinician, and the outcomes are less predictable. So the key is developing predictable outcomes in the course and knowing how to manage it either directly with the restorative techniques that are taught, or working with someone within the office or the laboratory is the key elements. It's developing predictable outcomes.
They leave the course feeling way more competent in their ability to deal with soft tissue around implants, way more competent in terms of their dealing and interactions with other members of the interdisciplinary team. They know more what goes into the case planning, and as a result, their case acceptance has got to go up.